I'm Courtney. That's my real name. I'm a second-year resident in the Samaritan Internal Medicine Residency program here in Corvallis, Oregon. And that's Bigfoot.
Huh?
He's a mythological creature in the Pacific Northwest. He's not real. Sorry, big guy. You've probably been watching a lot of these videos so far, wondering, is that really what that program is like? Do they really offer
unparalleled clinical training, unparalleled commitment to patient care, world-renowned educators? What? Who are also unparalleled.
After a while, it could be hard to tell what's real and what's exaggerated. And what you really want to know is simple. Can you picture yourself here? Nailed it. Well, my fellow residents and I are here to help. We're going to show you what it's like here. Really like. So you can decide if this is the right place for you.
As you can see, we're a really fun group. But to be clear, our residency program is not about having fun. Sorry, Bigfoot. It is about getting the best training possible so you're prepared for a career in general internal medicine or to pursue any fellowship of your choice. A lot of your training will happen right here at Good Samaritan Regional Medical Center. It's one of only 5 Level 2 trauma centers in the state and attracts patients from a much bigger 3-county region that stretches all the way to the Oregon coast. So you'll see a really diverse range of pathology and experience some really incredible learning opportunities.
This morning, I've been diagnosed disseminated cardiosis.
I just presented a case on cardiac angiosarcoma at a national conference.
I completed a thoracentesis.
Wait, why are you all riding bikes?
Because Corvallis is one of the most bike-friendly small towns in the country. In fact, 97% of our main roads have bike lanes.
Huh, that's some really helpful information. But why are you all riding bikes inside?
We know people have really short attention spans, so we add something unexpected to keep them watching longer.
You're probably wondering about our faculty, what they're really like. Well, they're actually pretty cool.
So?
Not cool like that. They're cool in how supportive and helpful they are, and approachable and relatable. Take Dr. Ransdell. She's our associate program director, and we took a hip-hop dance class together. For real. Ready?
Ready.
Hit it.
We got an admission down in the ER. Can you meet Dr. Small down there and I'll meet you guys down there in a few minutes?
Yeah, of course. Can you do... Of course. Can you do... Of course. Can you do... Oh, gosh, that wasn't it either. Of course. Can you take over the video?
Of course I can.
Go admission order set!
As you can see, we're okay with our residents making mistakes. In fact, we celebrate it. How are you going to learn, really learn, if you're expected to be perfect? At Samaritan, we emphasize providing a safe learning environment, so you're able to ask questions and, yeah, make some mistakes. Something else you'll see that makes us really different than other residency programs is the way in which we give and deliver feedback. Our residents design their own feedback forms based on their individual learning goals. Yeah, this all looks great. We can definitely get your feedback on your assessments and plans, and on your presentations, and your discharge summaries. Anything else?
What about that other thing?
No, we can't help you with your Tinder profile. I'm sorry. We also really value the residents' opinions too, and ask them for feedback continuously on our performance. Speaking of which, hey, how am I doing?
Good delivery. You seem relaxed and natural.
Nice and clear. You're providing some really good information. Maybe just slow it down a little bit. Other than that, great.
Thanks, I'll keep that in mind. Thanks, I'll keep that in mind.
Now that you have a sense of what life's like inside the hospital, you're probably wondering, what's there to do when you're not working? Not much, really. Unless you like to.
Kayak down to wherever.
Go mountain biking!
Go sandboarding.
see some amazing views.
Enjoy some amazing waterfalls.
Relax at a rooftop restaurant. Cheers.
Unwind at a local winery.
Shop downtown.
Hike through an old-growth forest.
Pick up local produce at the farmer's market.
And the best part is, because we're such a tight-knit group, there's always someone to do something with. Hey, who's up for windsurfing on Saturday?
I am.
Do you guys ever work around here?
So there you go. A real look at our residency program from the real residents who are here. I hope we were able to give you an accurate view of what our program is really like. Hey, how did you guys want to end this again?
Hey, it looks like Bigfoot wants to throw a dance party.
Hit it.
So. So.
I think that was it. Why did you nod your head now?
She's my posse.
Unparalleled clinical. Sorry. Unparalleled clinical training.
Hi, I'm Courtney. That's my real name. I'm a second year at Samaritan Internal Medicine Residency program.
Sorry, we'll do it again.
Of course. Can you take them? Sorry. I'm just freestyling.
Cheers. Oh, quite authentic.
Corvallis was voted one of the best friendly small towns in the country.
Just presented a case on cardiac angiosarcoma at a local national doctor.
So we figure adding an unexpected element will help.
That's okay.
That's okay.
Sorry.
Sorry, me. I forgot my line.